Hello, this is Jacob Avila, and today we're going to talk about how to do the hip examination with ultrasound. Now, there are a lot of things you can evaluate with ultrasound of the hip, but what we're going to focus on today is basically looking for hip effusions. Your probe of choice for this exam is going to be the linear transducer, but there might be some instances where you have a little bit too much space between the skin surface and that hip joint itself, so you might want to use the curvilinear transducer. Both work well, but the linear is going to give you a better looking image. So think about this area right here. This is your hip joint. So as far as where to place the probe on the patient, you're going to want to place it along the axis of the femoral neck, so this way. And as far as the probe marker itself, by convention, you want to place the probe marker up towards the femoral head and the acetabulum. So here is the anterior part of the hip. So we have our femur right here, and we have our femoral neck down in here. Up here, this little guy right here is going to be the iliofemoral ligament, and right above that, this is the iliopsoas muscle here. This little guy over here, this little triangular shaped thing over here, is going to be the rectus femoris, and the superficial one's going to be the sartorius. All this stuff doesn't really matter. What really you care about is this space right above the femoral neck and the femoral head over here. This is the anterior joint space, and this is what you care to evaluate. Now, you definitely can fan up towards the patient and get to the acetabulum up here, but the place you care about, like I said, the most for hip effusions is going to be back towards the femoral neck. Now, on the right side is going to be normal. You might have a little bit of that synovial fluid right in there. But if you look over here on this side, you have an insane amount of fluid right here. So this is what abnormal looks like, and this is what normal looks like. So joint effusion, no joint effusion. So as far as what numbers to look for, they do throw around an absolute height of about 7 millimeters from this distance to this distance as being abnormal. But probably a better way to look at it is comparing the good side to the bad side. I actually do that fairly often with my musculoskeletal examinations. If I think something's abnormal, I'll just look on the other side and see if that side has it as well. So if you have a difference in the height of that fluid of greater than 1 millimeter between the affected and the unaffected side, that is considered an abnormal finding, and you'd be concerned about an effusion in that patient. That's it for this week's 5-Minute Sono. Please feel free to send me an email or a tweet if you have any questions. And as always, don't forget to subscribe. Go to blog.5minutesono.com/subscribe. Put in your name and your email address in the little text boxes and never miss another video. And if you want these podcasts sent directly to your smart devices, go to whatever podcasting service you use, type in 5-Minute Sono and subscribe. And if you guys ever want to get a little bit of hands-on with me, with Mike, with other Mike, with Matt Dawson, Ben Smith, just go to our website listed here and check out the amazing conferences that we have listed this year.